Back here in Hamilton, disturbing new numbers from the Hamilton Homeless Mortality Data Project. The advocacy group saying 21 people experiencing homelessness died between June and November of last year. They say overdose was the cause for 52% of those deaths. Manisa Donabalan joining us live in studio tonight to break down the numbers. Good evening, Manisa.
Good evening, Matt. This group has been collecting information for about 3 years. The number of deaths aren't growing higher or lower compared to previous data sets, but advocates say it's alarming that the numbers aren't going down. The total number of deaths from June 2021 to November 2023 is now at 91, which represents an average of 1 death every 10 days. The data also reveals that several people died within 30 days of accessing social or healthcare services. The average age among those who died is 46 years old, which is much lower than the average age of death of Hamilton residents who are housed, which is 81 years old. Advocates say permanent rights-based housing is needed immediately to lower these rates.
Largely people are dying in their 30s, in their 40s. That is not the average age of death for a Hamiltonian, which is in their late 70s, early 80s, right? So homelessness in and of itself is killing people, right? Regardless of what the causes of death are, people are dying way younger than they are if they're housed. We need to be housing people urgently because we know that that's a life-saving intervention. It's a basic human need. And when you put people in places where they have a permanent place they can belong, it makes accessing supports easier.
Advocates reiterate calls for supervised consumption and other harm reduction strategies because overdose is the leading cause of death, according to the data. Matt?